Thank you everyone for joining us today. Before we start, we are going to remove our masks because we are 6 feet apart and we are social distancing. Thank you, Dr. Baswar, for joining us today. He joins us from AdventHealth DeLand. He is the medical director of our endovascular laboratory here, and he also is board certified in cardiovascular disease, interventional cardiology, nuclear cardiology, and echocardiography. So thank you so much for joining us and for wanting to talk to us today.
Well, thank you very much for having me. I appreciate you inviting me to join you today.
Excellent. So here at AdventHealth DeLand, I work in the marketing department and I'm Ivy Guardiola, but I'm always very curious to understand now with COVID-19 and all the different things that we are experiencing. Tell us, doctor, are you seeing any other cardiac conditions that we should be wary about, or the regular, coronary disease issues?
Yeah, so that's a good question, because obviously, as you know, COVID is something that's new and we're still doing research on that and such. So it does affect the heart, and there are some conditions that are associated with COVID infections. But, and those are things that are still being studied, and we're still working on trying to come up with newer treatments for this. But the fact remains that coronary disease and heart disease is still a big factor, and it's a major cause of death in our country. And so, unfortunately, that is still a prominent condition, and so it's something that we're still treating.
Okay, that's good. Well, that's a very good, but I'm glad to know that you're still looking into treatments and options and trying to learn more about this virus, but also how it's affecting our hearts. So tell us, if we want to prevent or lower our risk for cardiac conditions, what are the risks, and then what can we do about them?
Yeah, that's a great question, because obviously prevention is key. Of course, we have ways to treat diseases once they develop, but we try and prevent. As you know, heart disease or coronary disease is a major cause of death in the Western civilization, and it begins by a process called atherosclerosis, where plaque builds up in the arteries, and specifically the heart, but also it builds up in other arteries in the body as well. And there are a lot of risk factors for this. The main risk factors, of course, there are some that we can control and some we can't. So family history is a big risk factor, which unfortunately we can't control. Age is a risk factor, and that, of course, we can't control. But there are things that we can control, such as smoking, tobacco use, whether it's cigarette smoking, cigars, even the electronic cigarettes are harmful, and so those are things that we can control to avoid smoking and basically stop any use of the nicotine products is a big risk factor. In addition, there's a few other diseases which contribute to this atherosclerotic process, such as diabetes. And diabetes is a very prevalent condition in our society, and that controlling diabetes is very important. The other is hypertension, high blood pressure. That's where blood pressure is high, and over long periods of time, it can cause a lot of damage. And unfortunately, there aren't many symptoms with high blood pressure, so it can be present for a long time before it's even treated. High cholesterol is another risk factor. So there are several risk factors there that we can try and control. We'll talk about other ways of controlling those as we continue.
Oh, perfect. Thank you. That information is really good, because we need to understand whether or not we're at risk, and like you mentioned, what can we do about it? And during all this time that our lives have changed so much, right? is how can we still take care of ourselves. So thank you so much for that information. But other than prevention, what if I start feeling symptoms? What are the key symptoms that really should alarm us and we should pay attention for when it comes to our hearts?
Yeah, so for heart disease, and we're talking about coronary disease where plaque builds up in the arteries and causes narrowing and blockage, it can cause symptoms that are called angina or chest pain. So that includes pain or pressure in the chest, includes shortness of breath symptoms. Sometimes the pain can go to the left arm, to the neck, to the jaw. It can involve different sites. It can cause other symptoms like nausea or vomiting and feeling very sweaty. And so those symptoms can be signs of blockage in the heart or even heart attack. So those are symptoms that are very key to understand and to seek help if those symptoms aren't getting any better. So that's something that patients should feel very safe about is, if there are symptoms like that, coming to the hospital, coming to the emergency room, or contacting your doctor is still very important. And even though patients may be apprehensive about COVID and everything, emergency rooms, hospitals and physicians' offices take a lot of precautions to make sure that we're socially distant and wearing masks and taking temperatures. So but those are key symptoms to watch for.
That is good to know, and good to hear that you encourage us to go and seek medical attention, whether it's in the hospital, if it's truly an emergency, but also your primary care physician or a specialist that can look for those risk factors and track our heart health. So that's good. Thank you, doctor, for that information. So if I feel any symptoms, I go and see my physician, and I all of a sudden I need treatment or something to take care of my heart condition. Can you talk a little bit about what are those latest treatments or procedures that nowadays will help us, because we are always wanting not only to take care of the ailment, but also survive and be happy and live, a good lifestyle. Can you talk us about that?
Yeah, so that's a good question. So getting back to some of those risk factors and the preventive side of things, as far as diabetes, controlling blood sugars, medications to help with controlling diabetes, and there are newer medications that are out there that actually in some patients who have heart failure or other cardiac conditions have been shown to help as well. So there are newer diabetes medications on the forefront. As far as cholesterol, of course, diet is very key. So there have been national guidelines that have been set up, like food pyramid, which shows different areas or different types of foods, such as grains, fruits and vegetables, dairy products, and it also breaks it down as far as what kind of grains are best, what fruits or vegetables are best. So those are very helpful as well. Also, as far as cholesterol goes, there are medications that we have used for a long time called statin medications, which are powerful at reducing cholesterol. There's also newer medications now, which are injectable medications, which can be injected by the patient themselves once a week or once a month, and they are very potent at bringing cholesterol down. So patients who really need strong medications, we can provide those. So those are some newer treatments that we use. As far as procedures, when we do diagnose coronary disease or blockages, we do procedures to help with opening up the arteries to reestablish blood flow to the heart. So if the patient is having a heart attack, we do these procedures emergently, right at the time we see that on the EKG, and we do what's called a cardiac catheterization, where we go up to the heart through the wrist artery or through the groin artery, but and we inject the dye and see what the arteries look like, and then we can use balloons and stents to open up the blockages. Now we're doing it more from the wrist approach, which is also a newer development, and it's something that's more comfortable for the patient, less risk of bleeding, and so there are a lot of advantages to that as well. So from the standpoint of treating coronary disease and such, there have been advances made as well. So we can talk a long time about all the different types of tools and tricks that we have to help with this, but there's a lot of new resources which help. One other thing is diagnosis, and in diagnosing heart disease, and so if a patient has those symptoms or risk factors, we do procedures such as stress tests to uncover any blockage which may be significant there. There are also newer techniques out there, CAT scans, CT for calcium score, looking for calcium on the heart arteries, which could be a sign of significant blockage. There's also CAT scans with what we call angiography, so that gives us an idea of what the heart arteries look like if there's any blockage there. So there's a lot of new developments, and even down the road there's CAT scans with what we call FFR, which can give us a good idea of how significant blockage is. So the field of cardiology continues to expand, and newer modalities that we keep in front of.
Oh, that's great to hear, because while you were talking about all those technologies, they seem a little bit less invasive than before. So I would say, back in the day, my grandparents, would talk about cardiac health, heart health, and the diagnosis very different than today. So I'm so glad that you are telling us all this new information, and definitely informing us and educating how we can prevent, also how we can identify symptoms, and what can we do about them. So thank you very much, Dr. Baswar, for your time. Thank you everyone for joining us today. Take care of yourselves and take care of your heart. I hope you have a great rest of the week.